Here's our patient today. She's a 62-year-old woman who does not like the droopiness of her neck and her jowls. In addition to that, she has lost volume in her cheeks. She technically has more volume down here than she has in her upper cheeks. Take a peek at her from the other angles. Same thing. She's got this looseness that she wants to get rid of, and we're going to add some volume. So we're going to do a three-dimensional volumetric facelift today. We're going to do a lower facelift to tighten up her lower neckline, her upper neckline, and her jawline, and we're going to take some fat and we're going to inject fat into her cheeks, through her nasolabial folds, and to plump up her lips. Now we're also going to be using some PRP today. I'm going to spray some PRP into the surgical site with the facelift to reduce bleeding and bruising, and we're going to mix a little PRP with the fat grafting to get slightly better take and less bruising. So let's take a peek at her in the OR. And I'm going to also put some fat into her cheeks here, underneath her eyes, and we're going to help to reshape her face, so get her a nice change here. Alright, let's take a quick peek at her markings. We're going to make the incisions in front of the ear, extending behind the ear as well. This is the jawline. I'm going to reduce her jowl, and we're going to do a lift in this manner. Let me show you the fat grafting. Alright, we are all done. You can see we did the lower facelift. Everything went great. She's got a really nice sharp neckline. So I think she's going to be real happy with that. You'll see there are the little incisions around her ears. We'll take her stitches out in about a week. Now let me show you the fat grafting. So obviously she's puffy and swollen. Put a little bit of fat in her lips. The lips always swell a lot. Really injected some fat into the upper cheeks, up through here, where she is deficient. And so the idea would be to do a bit of a lift and filling out of the cheeks. So I'm really excited to see how she's going to look when we're all done. Okay, we are now 3 months out of her surgery, and I'm just going to take a peek from the side here, and you can see she's got a nice sharp jawline. There are the little scars around the ears that are healing real nicely, and the good thing that what I really like is you can see the volume from the fat grafting and just looking nice and naturally youthful. Great. So what's the difference between a three-dimensional volumetric facelift like you just saw in this video or a traditional two-dimensional facelift? Well, a three-dimensional facelift combines the lifting of a two-dimensional facelift with the addition of volume by fat because the face ages in 3 dimensions, not 2. This does add a little bit of time to the surgery, about 45 minutes. It adds about a week recovery because you're quite puffy from the fat. But the scars are the same, and it really is a nice way to three-dimensionally and naturally turn back the clock. Check a peek at some of these cool videos that are on the screen coming up right now.